So your vision has slipped since you had LASIK surgery and you're considering an enhancement. First, let's get something straight. The word enhancement is a misleading term for a second surgery. A second LASIK surgery carries most of the risk of the first LASIK, but some risks are even greater with a second surgery. For example, removing more corneal tissue places you at greater risk of post-Lasik corneal ectasia. See the video description below for a link to my video about post-Lasik corneal ectasia, which is the most feared and dreaded complication of LASIK. You say you've never heard of post-Lasik corneal ectasia? I'm not surprised. It's the complication that LASIK surgeons desperately hope prospective patients never hear about. Be sure to watch the video. Corneal ectasia may not occur for months or years following LASIK. There are likely tens of thousands of cases of post-LASIK corneal ectasia in the United States and many more worldwide. Another complication associated with repeat LASIK surgery is epithelial ingrowth. This is a condition in which the surface cells of the cornea, the epithelium, migrate under the LASIK flap and proliferate. This is much more likely to occur when a LASIK flap is lifted for a second surgery. It can progress to a very serious and sight-threatening problem. It is often difficult to manage and it tends to reoccur. Actress-comedian Kathy Griffin suffered from a severe case of epithelial ingrowth after her repeat LASIK surgery. You can watch a video about Kathy's experience with epithelial ingrowth on YouTube. Please look for the link to the video in the description below. Diffuse lamellar keratitis, or DLK for short, also occurs with greater frequency with repeat LASIK. DLK is inflammation of the cornea, which can lead to vision-impairing corneal scarring. If DLK progresses, it may require surgical intervention. Severe cases of DLK may progress to melting of the LASIK flap with associated vision loss. So now you know at least 3 complications of LASIK which occur with greater frequency with a second LASIK surgery. Not to mention the usual risk of LASIK, such as dry eyes, persistent neuropathic pain, infection, visual aberrations, and flap complications. Bottom line, virtually every LASIK patient will be back in glasses sooner or later. Don't expose your eyes to more unnecessary risk by chasing temporary freedom from glasses. It's simply not worth the risk.